probably the most questions that we get about any assessment is about FBAs, or functional behavioral assessments. So again, if you can explain what that is and when a child qualifies and when they don't.
So an FBA stands for functional behavior assessment. In order for a student to have a behavior intervention plan, they don't have to be in special education. It's a gen ed service. So there's like different tiers of behavior plans. So the most commonly used that I'll refer to is a PBIP and a CBIP. You have a positive behavior intervention plan and a comprehensive behavior intervention plan. Some districts may refer to it as tier 1, tier 2, tier 3. The PBIP, or the lower tier, is much less comprehensive. It's much more straightforward, like a single page, doesn't require an FBA per like the law. So people can just put their heads together and develop this plan to support a student, right? If you need a comprehensive behavior plan, it requires an FBA. So that's one way in which the FBA would be triggered. If this PBIP isn't working, it's proven to not be effective, we're still seeing behaviors, we need more data. As a BCBA, personally, anytime there's behavior, we want data, right? So I always push for an FBA if, you know, it's something that requires some level of a plan, because, you know, like ethically, it doesn't really make sense to develop a plan if we don't know why and what's happening. I also think it's important to point out that it also depends on like the eligibility or a medical diagnosis outside. Like a lot of what I see oftentimes, particularly for like ADHD, is we're like writing these behavior plans for kids who are off task and inattentive and distractible when it's like part of who they are and it's part of their disability. So keeping that in mind and making sure that the assessment is taking that into consideration. And I will say like 99.9% of assessments I see in the area of behavior don't do that. They're very straightforward, very surface level, just looking at the 4 functions. Is it for access, escape, da, 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 da. Doesn't take into consideration anything internal. You know, is there emotionality tied to it? And the most common goal I see is, let's teach the kid to ask for a break. And then what happens is we're teaching these kids to ask for breaks, and then they're asking for breaks all the time. And then we're having behaviors because we have to bring them back from breaks. So FBAs are great. I think they're necessary. I think they're poorly done. I think there's a shortage of behaviorists to adequately support the area. So for parents to know, just like with all the other assessments going in, you really need to know your child as a whole and make sure that the recommendations make sense. You're questioning how it's going to be supported, what strategies are going to be put in place. And also first, even before all of that, looking at the environment. Is the environment even properly set up and conducive to helping your child? Because that could be the reason why. And once you fix that, they don't even have the behaviors anymore.